Hello, good morning.
Yes, doctor.
Shash, I am a doctor of this clinic. May I confirm your name and age, please?
Yes, doctor. I'm Sachin Tendulkar, 22 years.
Nice to meet you. How can I address
Doctor.
you?
You can call me Sachin.
Okay, Mr. Sachin, I have got a letter from your GP saying that you have chest pain. Is it right?
Yes, doctor.
I am going to take detailed history about your condition, and during our conversation, I may take some notes. But all the information during
Oh,
our discussion will be remain confidential. So will it be okay for you?
yes, doctor. It will be all right.
So can you please tell me in your own words what is happening with you?
Doctor, since morning today, actually, doctor, I have been having some serious chest pain, doctor. And it was so serious, doctor, that I thought that I'm going to die, that I'm going to pass out, doctor. And actually, I have never faced this type of pain before. So I'm really frightened, doctor. Have I experienced an heart attack? Am I going to die, doctor? What's going on and what will happen to me, doctor?
Sorry to hear that. And can you please tell me that where did you feel the pain? Can you show me the site?
Yes, doctor. I think it's at the midpoint, doctor, of the chest.
Okay. And did it start suddenly?
Yes, doctor. I think it started suddenly, doctor.
Okay. And after the onset, how long it persist?
Doctor, I think I told you that it's from the morning, doctor. It's around 4 hours now. I still have the pain, doctor.
And
And I came to the GP. He gave me some medication uh, before coming here. After taking that medication, he also gave me some medication, and after that, I now I feel a bit good, but till it's not passed away totally.
I'm sorry for that. And do you think that you need immediate management for that, or we can just continue?
I don't think so, doctor. I think I can talk with you at this moment, but still, I feel some pain. I cannot, I won't deny it. Okay.
So after the finishing of the conversation, as soon as I will take care of your pain.
Okay, doctor.
And can you tell me that this is the first time or you have this pain ever before?
Doctor, this is the first time, doctor. I haven't experienced this pain before.
Okay. And can you tell me that what is the feeling of your pain? How will you describe the feeling of your pain?
Doctor, I think it's very much pressing. Okay, it's like that a big stone is put on my chest, and it's very much pressing me. Okay, it's very much suffocating, doctor.
And sorry for that. And does this pain go anywhere?
Yes, doctor. At the beginning, I didn't feel it, but now after around 1 hour, I felt that I had some pain in my jaw and some pain in my in the inner part of my arm as well.
Okay. And can you tell me that is this associated with any shortness of breath?
No, doctor, I am not feeling any shortness of breath at this moment.
Any racing or pacing of your heart?
No, doctor.
Any excessive sweating?
Yes, doctor. I have been facing some excessive sweating, and I actually also vomited once.
Okay. And can you tell me that did you ever ever lost consciousness during this time?
No, doctor. It's only 4 hours. I told you. I haven't lost consciousness, doctor.
Okay. So I am going for other conditions. That do you have any headache?
Sorry.
Do you have any headache?
No, doctor.
Okay. And any cough?
No.
Okay. And have you ever noticed any
Hmm.
shortness of breath while you walk or while you do any work?
No, doctor. I have been quite a normal person, doctor. Actually, but I am very frightened because of this. What happened that I have been facing this type of grave problems, doctors, all on a sudden. I have been quite well, doctor. No problem with my chest or what you're calling racing, pacing, heart problems. I haven't faced any of those before.
Okay. So I'm going for a systemic query question. For this, I would like to know that if you have any changes in your vision,
No,
any rash anywhere in your body,
not rash, doctor. I think I have some small lumps. Okay, in various parts of my body.
Can you tell me more about that?
Yes, doctor. I think it's been around 6, 7 to 8 years, doctor. I have some lumps in the back of my head and hand around my elbows. Okay, there's very small lumps. This comes and goes. Okay, so I have faced it for a long time now.
Have you ever seek any medical attention for that?
Oh, doctor, these are very small, so I didn't think that it can be important.
Uh, does this bleed or ulcer make any ulcer or soreness?
No, doctor, I haven't faced like that.
Is it easy?
Sometimes, doctor, sometimes.
And is it painful?
No.
Okay. And is it increasing?
Doctor, more or less same, doctor.
Have
But
you ever,
sometimes I think that recently I have faced that I have some spots like that in my eyes as well.
can you tell me more about that?
Oh, doctor, when I go in front of the mirror, I think that there are some color changes in the inner part of my eyes. Doctor.
Okay. And what type of color change?
I think, doctor, it has gone a bit more yellowish, doctor.
Okay. Sorry to hear that. And may I know that do you have any problem with your appetite?
No, doctor.
Have you noticed any changes in your weight recently?
No.
How about your? Do you have any problem with your with hot or cold preferences?
No, doctor.
Any rash or any ulcer in the mouth?
No, doctor.
Any changes in the skin apart from the lumps you
No, no,
described?
no. No other changes.
And may I know that do you have any pain in your tummy?
No pain, doctor.
Any lumps or bumps in your tummy?
No.
How about your water walk?
It's quite well, doctor.
And your bowel habit?
Go well.
And do you have any joint pain?
No, doctor.
Any weakness at any side of your body?
No.
And do you have any past medical condition that you would like to share?
Past medicine? No, doctor. I haven't known of any.
You said you have some rash. Have you noticed that anything that brings the rash or anything that
Doctor, I haven't noticed it, doctor. I haven't noticed anything like that. It has become a part and parcel of my life nowadays.
and is it may I know that do you take any medication?
No, doctor.
Any over-the-counter medication or any herbal products?
No, doctor.
Do you have any allergy to any medication?
No.
I am sorry to ask, but it is very important to know. Will I proceed?
Okay.
Do you take any party
Yeah.
drugs or any other IV drugs? Any recreation?
Never, doctor. I live a very healthy life. I don't smoke, don't drink alcohol, and don't take these type of things.
And can understand that. And may I know that any of your family member have this type of condition?
What condition, doctor?
Any problem in their heart or any other disease that runs in your family?
Well, doctor, I actually don't know, but what happened is that my mother had an heart attack when she was 40. That's all I know.
I'm sorry to hear that. I am going to ask you a very personal question. Will it be okay for you?
Okay, doctor.
You said that you don't drink or you don't smoke. That is a very good thing. And may I know that what do you do for a living?
Doctor, I am a school teacher, doctor. Sorry, I'm a player. I play cricket.
And may I know that is this condition is affecting your daily life?
Well, doctor, it's only for 4 hours, so I cannot tell will it affect or not.
Sorry to ask that. And may I know that whom do you live with?
Doctor, I live completely alone, doctor. I'm only 22. I'm not thinking about anything like living with somebody now at this moment of my life.
And do you have any history of recent travel?
No, doctor.
So, do you want to add anything?
No, doctor. But actually, you are telling that it might. I'm afraid when you are saying that it might harm. I'm not sure whether it will harm me or not. And I also drive, doctor. Will it cause any problem in my driving? I don't know. Please help me. And what's actually happened? Am I going to die, doctor?
I'm sorry to know that, but actually, at this point, I would like to recommend you stop driving, and I will let you know after our final diagnosis that for how long you should refrain yourself from the driving. Will it be okay for you?
Okay, doctor.
Okay, and one thing that one another concern is that you are thinking that this may be a very serious condition, and at this time, I am very sorry to tell you that I am thinking also that this is a very serious condition also. But with treatment, this can be controlled.
What is it, doctor? Can you please tell me?
Yeah, I am suspecting that this can be uh, due to heart attack. That is, do you have any idea
Oh my
about?
God, what are you telling, doctor? I'm only 22. I'm having a heart attack.
I am sorry to tell you that, but it seems like I have other different other possible diagnosis also that can also be happen. But at this point, I also came one. I also need to do some blood test and some imaging test. And one thing that you said that you have a family history of that your mother also died at age of 40, and
Yes.
also you have some skin lumps. I think they are connected
Yes.
with this condition.
Okay.
And for this, I will uh, admit you under the emergency department, and from the department, they will take care of you, and they will make a scan of your heart and do some blood test. And I think in the meantime, after coming to the hospital, seeing you, they have already given the emergency treatment.
Yeah.
We will go for the further treatment with the multidisciplinary team approach. That is, we will involve the doctor from the heart, doctor from another specialist, we call them hormone specialist, and also other doctors like other doctors like they are involved in your food. We call them dietitian.
Okay. Okay, doctor. So, what is the diagnosis actually? Can you please tell me? I just want to know.
Uh, I am suspecting that this can be a case of familial hypercholesterolemia, but that has causes high blood level of cholesterol, a very bad type of uh, substance in the blood that causes narrowing and sometimes blockage of the blood vessel. And when it block the blood vessels of the heart, then this type of symptom like heart attack can arise. I am suspecting that I am still not confirmed. I need to run some blood test, some imaging test, and after that I can give you the final answer.
Is the time over? I think it's over.
Yes, over.
Okay.
It started at 22
So,
and it is 37, 15 minutes.
yeah, yeah. Okay. Okay, that's all right. And so now, what do you think the diagnosis is? Oh, would you like to do the examination?
Yes.
Yes, please carry on.
I'll go for the cardiovascular examination. For this, I will go for the hand examination for any cyanosis,
Sweating,
then
sweating
pulse.
present.
Okay.
Pulse rapid, tachycardia.
Okay. And after that, I will measure the BP. I'd like to measure the BP on both side, left and right side.
Okay, okay. It's a 140 by 90, 130 by 90.
Okay. And after that, I'll go for the examination of his rash, and they are
Yeah, I think
epileptic
it's
rash.
a tendon xanthoma.
Okay. And after that, I will go for the eyes for any xanthelasma.
Xanthelasma.
Anyway. Okay.
Okay.
And after that, I will go for the heart examination. Yeah.
It's almost normal, doctor.
Okay.
Just tachycardia.
Okay. And I will look for any murmur, basal crepitation.
No, basal crypts or murmur present at this moment.
And then I will palpate the abdomen for an organomegaly.
No organomegaly.
Yeah, I'd like to examine, do the fundoscopy and urine for dipstick test.
Okay, doctor. Fundoscopy is quite normal. Urine dipstick, there is mild proteinuria present.
No. Then my physical examination is over.
Okay. So, okay, so how? What do you think the diagnosis is in this patient?
At this younger age, my possible diagnosis is this is a case of acute myocardial infarction secondary to familial hypercholesterolemia. I have also differentials diagnosis like this can be a cause of aortic dissection. Then this can be my this can be
Good. You told that it's acute MI. I think by the symptoms, it's almost sure that it's actually acute MI. But can you please tell about the DDs of acute young onset acute MI?
okay for ring-on acute MI. The causes are like um, some are uh, recreational drug use like amphetamine. Then
Yeah.
familiar
Okay.
hypercholesterolemia, then hyperuricemia,
Mm.
then
Yeah.
certain other risk factors having risk factors with this type of patient like hypertrophic obstructive cardiomyopathy. Uh,
Yeah. Yeah. Okay. Some hereditary causes like
yes,
long QT syndrome, blue card. I think this could also be brought here. Okay. WPW syndrome. Am I right?
I am not sure if they are prone to develop.
Okay. Okay. Yeah. But okay, that's all right. But I think Takayasu is important. Okay. Takayasu arteritis. Okay.
Okay.
Takayasu can sometimes cause claudication, leg pain, and sometimes can cause this acute MI like presentations as well. Homocystinuria, you told. Did you tell homocystinuria?
Okay, I forgot. Actually, I told hyperuricemia. Actually, I wanted to mean homocystinuria.
Yeah, yeah. Familial hypercholesterolemia, homocystinuria. These are important. Takayasu arteritis should be kept in DD, I think. The other hereditary causes, specifically HOCM, as you have mentioned, and party drugs, okay, like cocaine, others as well. So I think these are the DDs. And so now, how would you investigate the patient?
Okay, this is actually an emergency case, so management and investigation should go simultaneously. And for the investigation part, I will go for the routine blood test for complete blood count, inflammatory markers, liver function test, renal function test, urine for uh, routine examination, then serum cholesterol level, and after that, I will go for the imaging test like ECG, echocardiogram, chest X-ray.
Hmm. Okay. And do you think any genetic testing or genetic counseling can be needed?
On the basis of the test and with as I don't know if familial hypercholesterolemia is associated with any specific gene, though it is a it is autosomal dominant condition.
Okay. Well, may I know that do you think that there can be any abnormality in the blood in the serum electrolyte level
Uh,
in this type
yes,
of
for
patient?
if the patient is having hypercholesterolemia, then they can show like pseudo hyponatremia.
Yes, yes. So that can be an important finding. Okay, okay. And others are that's all right. And the management.
Okay, this is actually an emergency management approach that is for maintenance of airway, maintenance of breathing, then maintenance of circulation, then preventing disability, then exposure and uh, other further management. And these patients needs immediate cardiac care admission, and after that you will go for the go for the further management on that basis like for pain cathetin and for his time being, if it is 4 hours, so we can go
Okay.
for the
And actually, he has come within 4 hours. So, would
yes.
you think about any intervention now?
Yes, as he has come with the within 4 hours, so we can go for the thrombolysis therapy, and also the cardiologist referral for uh,
Thrombolysis or PCI, I think. Okay.
yes, for coronary intervention
Okay. Okay.
and other
Okay.
support
That's all.
management.
Yeah. Yeah. Okay. So I think you have done it fairly well. Do you want to add anything? I think you did quite well in this practice.
No, I don't remember much.
Okay, but one thing I think you just missed, you just forgot to ask about driving. I think I told it myself. Okay,
Yes.
so I think that was just one thing. I told it myself, and others I think it was quite well. And can you add any DD, any other DDs?
No, I cannot remember much. I am feeling somewhat dizzy now.
Okay, okay, okay. So I think that's enough for the case. You can stop the recording. Okay.